Indiana sees nearly 250 cases of cervical cancer a year. There's a vaccine for the virus that causes cervical cancer that was introduced 7 years ago, but Indiana's vaccination rate for that virus still lags behind other states. Josh and Lynn reports on why rates remain low for a cancer that doctors say is almost completely preventable.
Kristen Forbes graduated from Indiana University, Purdue University in 2007 with a degree in business. She had a job right out of school, and she was excited about starting her life on her own.
4 weeks after graduation, her right ankle swelled up. And that's when the journey and the fight began with cervical cancer. And we buried her a year later on June 1st, 2008. She had multiple surgeries, she had chemo, she had radiation, several types of radiation, but it was so advanced, it was stage 3C when they first diagnosed it. And so it was, even though we didn't want to admit it to ourselves, the survival rate for that initial diagnosis was pretty small.
3 months after Kristen's death, the U.S. Food and Drug Administration approved the vaccine Gardasil a second time for the prevention of human papillomavirus, or HPV. HPV causes 70% of cervical cancers and has recently been linked to some types of oral cancer.
We found out very few people know anything about the HPV illness itself, human papillomavirus. Very few people know this connection to several cancers, and very few knew that there was a vaccine available and a safe one.
In 2012, Indiana's HPV vaccination rate among teenage girls was 35%. That's low compared to the rate of other vaccinations. So the question is, why are the HPV vaccination numbers so low in Indiana 7 years after it was approved? One factor is easy to point to. The HPV vaccine is not mandated for public school attendance, and a lot of parents might not know it exists.
So they're not anti-vaccine or concerned about HPV vaccine so much as it hasn't been recommended.
Zimmett and Forbes also say that expense and convenience can be barriers. You need 3 doses of Gardasil to have immunity, and it runs about $130 per dose. How are doctors and clinics dealing with this? Public health nurse Jane Keys says the Vigo County Health Clinic has greatly improved its completion rates for all 3 doses of Gardasil by sending out postcards and phone call reminders to parents before each appointment.
That the importance of is when you say it like it prevents cervical cancer and you tell the facts, the truth, then they're more adamant at getting it done.
The clinic is also covered by the CDC's Vaccine for Children program, which defrays the high cost of the HPV vaccine for patients who are on Medicaid or underinsured. Cost and lack of awareness paint only part of the picture, however. Some critics have raised the fear that the vaccination for HPV, which is a sexually transmitted disease, could increase promiscuity among teenagers. However, several studies have since debunked that assertion. And then there's the question about the vaccine's safety.
In my opinion, when we're dealing with vaccines, with the known risk of death, permanent disability, I can't guarantee you if I were to give you an HPV injection today that you will not be the one that will die from that. I can't guarantee you that.
Wagler is a nurse and a volunteer with the Indiana Coalition for Vaccine Choice. The group's members are concerned about safety and full disclosure of any problems with the drugs. She points to the Vaccine Adverse Events Reporting System run by the CDC.
I would say last time I looked, over 10,000 adverse events other than death reported associated with the HPV vaccine.
Language on the VAERS website cautions that a report does not prove a vaccine caused the adverse event. The CDC encourages patients and doctors to report any bad reactions around the time of a vaccination, regardless of cause.
What I would hope people realize is that it's really important that when it comes to policy, health policy, the practice of healthcare, that we don't base that on individual stories, but we base that on a lot of individual stories.
Indiana's vaccination rate is actually higher than in previous years, and advocates like Kirk Forbes are optimistic that those will keep increasing.
Vaccinate Indiana, which is the Indiana Vaccination Coalition.
Forbes has started a foundation in his daughter's name dedicated to educating doctors and parents about the HPV vaccine.
Somebody came to me and said, we have a vaccine here to protect your child from cancer. Would you like it? Absolutely.
And we should mention the HPV vaccine isn't just for girls. The FDA has recently approved the Gardasil to be administered to boys who can be carriers of HPV.